Okay, guys, I have for you. It's a bonus one. It discusses rheumatoid arthritis. Okay, the article provides an overview of rheumatoid arthritis, RA, a chronic autoimmune disease that primarily affects the joints. Here are some key points. Definition: RA occurs when the immune system mistakenly attacks the syn, syno, synovium uh, joint lining, leading to inflammation, pain, swelling, and eventually joint damage. Causes: well, the exact cause is unknown. Contributing factors include genetics, environmental triggers like smoking or infections, and hormonal changes. Women, particularly between ages 30 and 60, are more commonly affected. Symptoms: common signs include pain and swelling and small joints, hands and feet, morning stiffness lasting over an hour, and systematic issues like fatigue, um, malaise, and weight loss. Diagnosis: physicians rely on physical exams, blood tests, and imaging, such as X-rays or MRI, to confirm RA. Let me know if you want more details or connections to broader health research. Rheumatoid arthritis presents with a range of symptoms that vary in severity. Here are some specific symptoms you might notice: joint pain and swelling, usually in small joints like hands, wrists, feet. Morning stiffness lasting more than an hour, making movement difficult early in the morning or in the day. Symmetrical joint involvement, meaning one side of the body is affected, the other side often is too. Fatigue and weakness, a general feeling of being unwell or exhausted. Weight loss, unintentional due to inflammation and metabolic changes. Low-grade fever, sometimes present during flare-ups. Nodules under the skin, firm lumps, often near joints, especially in the elbows. Loss of joint function. As the disease progresses, joints may become less flexible, RA symptoms can fluctuate with periods of increased intensity, flares is what we call them, followed by times of relatively relief. If you're interested in emerging research or treatment approaches, I'd be happy to explore these with you. Okay, we're going to delve into those. Give me 1 second, please. Okay, emerging research or treatment approaches. I'd be happy to delve into those with you. Okay, rheumatoid arthritis, RA symptoms tend to progress in stages, often worsening if left untreated. Here's how the disease typically evolves. Early stage, mild joint stiffness and occasional swelling, particularly in the fingers and toes. Symptoms may be intermittent and mistaken for general wear and tear. Okay, 2, moderate stage, more persistent pain and stiffness, especially in the morning. Swelling becomes more pronounced and joints may feel warm or tender. Severe stage, structural damage begins, cartilage and bone erosion can lead to deformities and significant mobility loss. Nodules may form under the skin, and systematic effects such as fatigue and weight loss become more debilitating. Advanced stage, joint erosion deteriorates further, potentially leading to disability. RA may affect organs like the lungs, heart, and eyes, increasing overall health risks. RA doesn't always progress at the same time or same rate for everyone. Some experience slow changes while others have aggressive flare-ups. Treatments such as Mars disease, modifying anti-rheumatic drugs, biologics, and lifestyle adaptations can slow progression and preserve function. If you're interested in emerging therapies or patient centered strategies, I can explore those with you. Okay. Those with RA, those with you managing rheumatoid arthritis, RA effectively involves a combination of medication, lifestyle adjustments, and supportive therapies. Okay, medical treatments, disease-modifying anti-rheumatic drugs, such as methotrexate, help slow disease progression. Biologic therapies target specific immune pathways to reduce inflammation. Okay. Non-steroidal Anti-inflammatory drugs, NSAIDs, help with pain and swelling. Corticosteroids provide short-term relief during severe flare-ups. Lifestyle and self-care. Regular exercise, low impact activities like swimming or yoga can improve joint mobility. Anti-inflammatory diet, foods rich in omega-3, turmeric, and green leafy vegetables can help. Weight management, reducing excess weight eases strain on joints. Stress reduction, mindfulness, meditation, and relaxation techniques may improve symptoms. Supportive therapies, physical therapy strengthens muscles and improves flexibility. Occupational therapy helps adapt daily routines for easier movement. Okay. Give me 2 seconds. Adaptive devices, braces, splints, and ergonomic tools can help with mobility. Heat and cold therapy, warm compresses, relax stiff joints. Cold compacts, reduce inflammation. Would you like to explore new treatments, developments such as gene therapy or experimental medications? Your interest in emerging health trends suggests you might find these avenues worth discussing. There are several promising new treatments for rheumatoid arthritis, especially in the realm of targeted therapies and regenerative medication. Here's a look at the latest developments. Advanced drug therapies, JAK inhibitors. Okay, new oral medications that regulate immune system activity and inflammation. Biomarkers, biosimulators, cost-effective alternatives to biologic drugs. Expanding treatment accessibility, STING inhibitors, and experimental class targeting immune response pathways to reduce joint inflammation. T-cell modulators, drugs that adjust immune cell behaviors to minimize RA flare-ups. Regulative cutting-edge approaches. Stem cell therapy. Research suggests stem cells may help repair joint damage and modulate immune responses. gene therapy. Scientists are investigating ways to modify genetic markers linked to inflammation and joint degeneration. Personalized medicine, AI, and genetic profiling are helping match patients with the most effective treatment options. Lifestyle adjustment therapies, microbiome research. Studies show gut health may influence RA symptoms, leading to probiotic focused interventions, patient rich plasma or PRP therapy being explored for a potential to reduce inflammation and tissue repair. Adaptive deep brain stimulation through the mini through the mainly for Parkinson's disease. Its effects also help RA guys. So, like I said, whatever works for people's trials, I'm all for that. So, an immune modulation in RA are intriguing. Would you like to delve deeper into experimental treatments or perhaps explore how person-centered planning can improve RA management? Your interest in healthcare innovations makes these discussions especially completing. Personalized medicine is transforming our rheumatoid arthritis, RA treatments by tailoring therapies so individual patients based on their genetic markers, biomarkers, and disease progression. Here's how it's making a difference. Key impacts: personalized medicine in RA, biomarkers-based treatment selection. Doctors can now use biomarkers to predict which medications will work the best for patient, reducing trial and error. Prescribing targeted therapies, new drugs like JAK inhibitors and biologics are being matched to patients based on their immune system profiles. Precision monitoring, regular assessments help adjust treatments dramatically, ensuring patients receive the most effective therapy at any given time. Multidisciplinary care models. Centers Signila are integrating personalized interdisciplinary care to improve patient outcomes. Future innovations. Emerging research is exploring gene therapy and stem cell. Okay, guys? All right. 2 more sheets. All right, so last page. Treatment and microbiome-based interventions to further refine RA management. Would you like to explore how AI and predictive modeling are shaping personalized medicine for RA, given your interest in health care innovations? That could be fascinating direction. Okay, guys, so that is it for tonight. I'll see everybody tomorrow for shows. I put these together. One. Okay. So like I said before, that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks. Have a good evening. See you tomorrow for shows.